Thankfully, these days, the thyroid is considered a lot more for couples trying to conceive than it was when I first started out as a fertility homeopath. However, there is one big problem I see is that there is still one single test that is often used to diagnose a thyroid problem and prescribe medication, when in fact, it could be that it's not actually the thyroid. There's another important hormone gland that is playing a role. So what if this is the case for you? What would it mean for your treatment?
Hello lovely, my name is Inge Sprey and I am a fertility homeopath. I help couples worldwide to fall pregnant naturally with the information that I provide in the videos on this channel and with my homeopathic programs, both DIY and live.
Welcome to another one of my videos in which we're talking about the thyroid again, but not just really the thyroid. Actually, we're going to talk about other hormone gland because, as I said in the intro, I often see that women come to me and say that they're on thyroid medication or they have a hypothyroid diagnosis. And then when I check out their blood test results on which this is based, I am seeing that a lot of tests are missing, that only TSH, thyroid stimulating hormone, has been tested. And when I look at their charts, I don't actually see a thyroid problem. The problem with this, of course, is that either medication is prescribed unnecessarily and or, which is even worse, the real problem isn't addressed. So you may think, oh, it is a thyroid issue. Great, I'm so thankful that we've uncovered this. Now I'm going to get medication, I'm going to work on thyroid health, and then we'll soon be able to fall pregnant. But if that is not actually the case, you are not solving the underlying issue and you're wasting a lot of time trying to fall pregnant because you're not addressing the real root cause. So in this video, I want to talk with you about 3 scenarios in which TSH may be elevated, and then look at whether that is indeed an indication of a thyroid problem or there may actually be something else going on. And the third scenario is the one that I kind of thought about when I was talking to you in the intro, and that is a really, really important and overlooked one that I never hear anybody talk about. But the first thing you need is, besides just your TSH check, so if you even got that, your thyroid stimulating hormone, you're going to want a full thyroid panel, especially if your TSH is elevated. And if your TSH is fine, or it has been fine, you've never been diagnosed with a thyroid issue, but somehow you're still watching because you are trying to conceive and trying to figure out what the heck is going on, then I encourage you to keep watching because I'm going to give a bonus scenario in which TSH is not elevated, but there could actually still be a thyroid issue going on. Let's get into it. So when I'm talking about a full thyroid panel, I'm talking about thyroid stimulating hormone, as we talked about TSH, but you also want T4 checked out and T3. If you've never had thyroid antibodies checked, that is worth considering because if you have elevated antibodies, then there is another issue. If you do have thyroid issues, then it's probably secondary because you have an autoimmune condition, and that requires even another approach than just simple hypothyroidism, so to speak. So those are the things that you're going to want to check out. Now, I have a video and an article that is all about the thyroid panel, and I'll make sure to link that down below or up here or whatever. You'll be able to find it somewhere because it is really important that you learn how to interpret your thyroid blood panel properly, because I still see often that practitioners say, oh, everything is within range, and off you go, when in fact your numbers may be within range, but they're not ideal. So they can still be playing a role in your problems trying to fall pregnant. And not just in falling pregnant, but if you do fall pregnant, you're more at risk of a miscarriage if your thyroid is not functioning properly. Okay, so scenario 1 is what I would call a genuine thyroid problem. And that is when indeed your TSH is elevated, but also your T4 is compromised. Because T4 is that first hormone that your thyroid produces, but TSH is not produced by your thyroid. It's produced by your anterior pituitary gland to stimulate your thyroid to produce the thyroid hormone. So you see how TSH, it could say something about your thyroid if it's high, because if your thyroid is not functioning properly, your anterior pituitary gland may grab the megaphone and start yelling at the thyroid or kicking it to make sure that it starts doing something. But it doesn't say everything about the thyroid unless you see that your T4 is also low or too low. And again, I remind you of the ideal numbers and not just of whether it falls within range or not. Really important for you is also in this case to understand what your fertility chart looks like and if there are signs of hypothyroidism in there, because even if your T4 numbers are kind of within range, or maybe not ideal, but they are within range, but you have very clear hypothyroid symptoms in your chart, or you're suffering from hypothyroid symptoms, then clearly there is a hypothyroid problem and you need to be addressing this. Now, this is something that I talk about on the Clues in Your Charts. The Clues in Your Charts is a program. There's a DIY version, and a couple of times a year I do a live version as well, and I help you to interpret your charts to recognize hormone problems. Because if your chart is not ideal, you're going to want to figure out what the issue is so that it can pinpoint you towards the right treatment, towards the right blood work or other tests that you want to do, or a practitioner. And hypothyroidism is one of the things that you can learn to spot really easily in your chart. But not only that, even if your T4 is low and your TSH is high, your thyroid issues might be secondary to adrenal stress and adrenal fatigue. And on the Clues in Your Charts, I show you how to see the difference, or how to see that hypothyroidism, that adrenal fatigue is going into hypothyroidism. So you need to be on full alert and start working on your adrenal stress. The second scenario is that indeed TSH may be elevated and T4 may be fine, but it's actually T3 that is compromised. That is a different problem because T3 needs to be converted. And that conversion can be affected by several other things. One of those things being steroids use. If you're currently on steroids or you have been on steroids for a while, actually that might be impacting your T3 numbers. So don't assume that if your T3 isn't ideal or it is even below range, that this is a thyroid issue. Your anterior pituitary gland is still going to bring up TSH to kind of stimulate your thyroid because it thinks, well, there's not enough T3, so it must be a thyroid issue. Let's do something about this, people. An even more simple reason for low T3 is stress. And Lord knows so many of us have stress. Just the fact that you're trying to conceive and it might not be happening as quickly as you hoped, you're trying to figure out what the reason is, that is enough to give you a whole bunch of stress. Now that is emotional stress, but we can also have physical stress in the form of starvation. If you are not nourishing yourself properly, if you're not eating, if you're skipping breakfast, this could cause so much stress on your body that it is experiencing starvation. Not only that, you can also go into insulin resistance and those kind of issues, or maybe you have being a very sporty teenager or even a sporty adult. I've had people in my practice that are very fanatic about certain sports or bodybuilding. And yes, it can impact your hormone balance overall, but it can also impact your T3. So if this is playing a role for you, that could be a clue. A really important part of the conversion to T3 is a healthy liver. We need a healthy liver in general for our hormone system. But if our liver is taxed, and that could actually even just be due to stress, but it could also be due to poor nourishment, it could be due to environmental toxins, it could be due to heavy metal toxicity. Fill in the blanks. If your liver is functioning suboptimally, that could impact your T3 numbers. And in fact, I actually see this probably more often with guys than I see with the ladies. Yes, thyroid issues can be a problem for guys too. Surprise, surprise. Definitely worth checking out your full thyroid panel as a guy when you are trying to conceive as a couple. Also, your digestive system needs to be healthy. Your gut needs to be working properly in order for you to be able to do this T3 conversion and in general for a healthy hormone balance, because if you are not taking out the right nutrients, that is a form of starvation, isn't it? And that impacts your whole system, your metabolism. And as I mentioned earlier, that alone can impact your T3 numbers. But also, you need to be able to eliminate waste and excess hormones like estrogen, for example. So if you're constipated, that is an issue too for your T3 conversion. So if you suffer with chronic constipation, or it alternates with diarrhea, or you have a known IBS issue, then realize that this is also what could be playing a role in your T3 conversion, and don't assume that it is a thyroid issue when your T3 is low. Low progesterone is another one, and low progesterone is something that a lot of women struggle with as it is when they are trying to conceive. And low progesterone could be the result of adrenal stress and adrenal fatigue. It could be the result of estrogen dominance. It could be the result of actual thyroid issues, but it can then also impact your T3 conversion. So you see, it's really important to try and figure out what is actually going on for me. And again, low progesterone issues you can spot in your charts. As I mentioned earlier in the Clues in Your Charts program, in which I talk you through what could be the reasons for your low progesterone, whether it is thyroid related, whether it is more actually adrenal stress, or actually it's connected to estrogen dominance, or maybe you're perimenopausal or you have overall low hormones. See, you always need to ask yourself the question, why? And as mentioned, the steroids used, whether current or past, can impact your T3 conversion, but that alone can have an impact on your progesterone levels as well. So detoxing steroids is one of the big things that I do in my clinic, and it's also part of Prep for Baby. And if you're interested in finding out more about that, I'll make sure to link in a video that I did about the impact of steroids on your fertility for both men and women. So you see, with this T3 conversion issue, there can be so many problems that underlie that don't necessarily have anything to do with your thyroid. And one more that is there is low iodine. And that is because it does actually impact your thyroid. Your thyroid needs iodine. I don't see a lot of people actually that are low in iodine, and that may have to do with geography, where people live, what kind of foods they eat. But if there is any reason to think that this may be the case, then it's always worth to have your numbers checked. I don't like just supplementing with iodine here and there. I've seen too many people that have actually been damaged by high levels of iodine, with the result that their thyroid becomes hyperthyroid and then becomes hypothyroid, when in the first place there was nothing wrong. So have your levels checked before you decide to supplement, and it's probably best to see a naturopath to help you with this and guide you. Now, of course, low T3 can actually be a thyroid issue, but then usually you will see that it goes hand in hand with low T4 as well. And then here is the scenario in which TSH is elevated. So scenario number 3, TSH is elevated, but the rest of your thyroid panel is not only normal, it is ideal. And this is exactly why I wanted to make this video, because I find that women are then still prescribed medication, thyroid medication, and this is where it doesn't solve the issue. Now, it is possible that you are pre-thyroid issue, and this is called subclinical hypothyroidism, so that you're catching it early. In other words, your anterior pituitary gland has kicked up the gears to raise TSH, and that stimulates the thyroid enough to just keep on going. But it does need the high TSH levels to actually keep on going. And if you have normal levels, your thyroid would be functioning at a lower level. So you're catching it early in that case. That's possible. What I see much more often is that the issue is the anterior pituitary gland. Because hello, if we're talking about the one that is screaming with a megaphone, is it the one that isn't, is it the receiver? Are you certain that that person isn't listening? Or could it just be that this one is yelling and not realizing that this person is listening? Does it make sense? There are two glands playing a role here. So could it possibly be that your anterior pituitary gland is actually out of balance? And of course the answer is yes, because otherwise I wouldn't be making this video. Duh. I see this all the time with patients, and the biggest culprit is the use of contraceptives in the past. This disrupts our anterior pituitary gland. It completely throws off the production of hormones to thicken the lining in your womb, to mature an egg, and then have it released. So when you then stop with contraceptives, that doesn't just mean your body's going to pick back up and be like, oh, I guess we're allowed to do this again. No, it doesn't work that way. It can leave an imprint on your hormone system that doesn't allow you to go back to its natural balance. And there, the anterior pituitary gland is playing a role. And the beautiful confirmation of this through all of my years as a fertility homeopath is that I then detox homeopathically the contraceptives with these women, and suddenly everything falls into place. Their thyroid issues are gone, or their thyroid symptoms are gone. They are ovulating timely again. Their luteal phase is long enough, and lo and behold, their TSH drops. In fact, I recently had this as a case on Fertile 40s. This lady was told that she had thyroid issues, but in fact, I diagnosed it as an anterior pituitary gland issue, both because of contraceptives used in the past and other synthetic hormones, but also because of trauma. I find that physical or emotional trauma can also throw off the anterior pituitary gland, especially if there was head trauma, but it can be all kinds of trauma. And this is where I then start treating the anterior pituitary gland. Now, the first step would be to detox any synthetic hormones that you've used in the past, like steroids, contraceptives, could be fertility drugs, could be labor drugs even, although I see that one playing less of a role. But sometimes you need a little bit of extra support, especially when you're nearing your 40s and you don't really have that much time, and you can't afford to just be detoxing one thing at a time. And that is when I support the anterior pituitary gland to heal specifically as well alongside the detoxes. So you're removing the baggage, you're removing the imprint, but you're also supporting that specific gland. And I do this on the program Fertile 40s, and yeah, the results are amazing. The cool thing about working with so many women at the same time is that you get to monitor lots of charts at the same time and see several ladies that are on the same types of remedies. So it's much easier to kind of compare. So you get bulk results in a sense. Now, because of the success of Fertile 40s, I'm soon also starting Fertile 30s because, well, you want to start solving as many things as quickly as possible and not waste time, and then run into your 40s and then also have to battle time at the same time. And the anterior pituitary gland support thing is something I will do there as well, because what I often find is that women don't just have the elevated TSH perhaps, and they're diagnosed as hypothyroid, but they have high prolactin. And high prolactin is also a very, very big clue as to the anterior pituitary gland being out of balance. And I've seen so many cases. In fact, I think my first fertility case was an elevated anterior pituitary gland case. And this lady, she had been trying to fall pregnant for 8 years, and she had several miscarriages, and she was already in her 40s when I started treating her. And obviously I didn't know at the time all the stuff I do now, but I did recognize that there was probably anterior pituitary issue because of her high prolactin that surfaced. And when we started treating that, I think she was pregnant within a month, maybe 2 months. And well, her kid is a young teenager now. So I do find that when you do treat that anterior pituitary gland separately, that these ladies fall pregnant very quickly often. And as I said, we even had that on the Fertile 40s program recently, and those cases were so relatively simple to solve, but you need to know where to look, right? It isn't always complex. And yeah, I promised you I would give you another scenario in case your TSH was fine, right? Scenario number 4, your TSH levels may be fine, maybe within range, you may be sent off, even though you're struggling with weight gain or losing weight, you're feeling cold, you're losing hair, you have brittle nails, you're seeing all of these symptoms that you read online as being hypothyroid issues. Then this is really time to check your charts. I always check charts because your charts are showing another picture, right? Another symptom picture. And we don't just want to go by blood test results, because these tests, they are all judged by ranges that we've agreed on, but we are human beings. We're all different. You might be at the beginning of the spectrum, you might be at the end of the spectrum, you might fall outside of it. So can we just follow your body's symptoms and how you feel in the first place, and not be like, ooh, your test results are bad. Yeah, but I feel wonderful. Yeah, but you're very sick. Here's medication. Makes no sense. Equally, the other way around. I feel really horrible. I'm near death. I cannot get out of bed. Oh, but your numbers are fine. It must be in your head. Are you kidding me? And this is where I find that your charts often give a lot of clues, because you can see a pattern over a longer period of time. And you can also see if what you're doing is helping you. And this is where I often am able to spot with my patients that there is actually hypothyroidism issue going on, even though the TSH is still fine. This is very similar to the subclinical hypothyroidism that I mentioned earlier. The body is still keeping up okay levels of TSH and the thyroid is keeping up more or less, but then when you start to do the full thyroid panel, you see that although TSH is fine, that T3 and T4 are within range, but not ideal. And we want them to be ideal to create the best circumstances for you to fall pregnant and to hold on to your pregnancy, to carry your baby to full term. So if a lot of the information in this video was new to you, I highly recommend for you to check out the resources and videos that I have on the steroids that impact your fertility, the contraceptives, because these are two very big culprits, which is why I put them in Prep for Baby. And everything in Prep for Baby is the foundation of what I think couples need to increase their chances of falling pregnant. And most couples, they're sorted after that. So there's a reason I put those things in there. So if this is new to you, definitely check out those resources. And if you already have a thyroid panel that you want to find out if your levels are ideal or not, then I have a video for that too. And you can click on your screen right now, and then I'll meet you on the other side. In the meantime, see you in the next video. Bye!